guys, Bill Parisi here, founder of the Parisi Speed School. I am with Adam Kahn, physician assistant, former athletic trainer for Hofstra University, and manager of Atlantic Sports Health over at 111 Madison Ave in Morristown, New Jersey. Doing a great job keeping things in order in that building, I'll tell you.
Well, thank you.
You do a great job. I know I went to see Adam when I hurt my neck not too long ago, and you fixed me up really, really well. But today we're going to talk about something that's prevalent with athletes, especially in the NFL and a lot of college level athletes, hamstring injuries. I mean, there's been so many hamstring injuries out there in the last couple of years. What have you found, in your practice and all the people that you see? Why are we seeing so many hamstring injuries?
Sure. So obviously hamstrings are very prevalent. The injury rates are very high. If you look at NCAA data, they keep a database of all college athletes and what they injure. Almost anywhere from 8% to 25% of athletes will experience a hamstring injury throughout their season, which is a very high number. Wow. And then obviously some sports is even higher than others. There's some studies out there with elite soccer players that show up to 50% risk. So what can we do? There are some studies that are showing some benefits where you have to work the eccentric loading of the hamstring, which I don't know if you've ever used the glute ham machine. I'm sure you have in your day. It is a very tough exercise to do. So for people to kind of incorporate that in their everyday activities is sometimes beneficial.
Yeah. It's interesting. The hamstring, the way it's constructed, it's a very easy muscle to injure because it's a double jointed muscle, right? And it crosses two joints. And when you think about having tight hip flexors, a lot of times, having a tight hip flexor can cause the hamstring to be in a challenged position.
Sure. So yeah, just like what you said, right? The hamstring starts at the hip, right? At the ischial tuberosity, and then comes along and crosses the knee joint. And based off the biceps femoris attaching on the lateral side or the outside, and then the semitendinosus and membranosus attaching on the inside of the knee. So, with that, there's multiple things that then affect it, right? So the muscle tightness itself, the hamstring, how tight it is, the strength of that hamstring. So not only compared to the opposite side, but also compared to the quad. So the quad hamstring ratio plays a big component. And then the pelvis, just like you talked about with a tight hip flexor, right? It puts your pelvis at an anterior tilt, which means the posterior aspect of the pelvis is tilted upward and puts a stretch on that hamstring. So a lot of times you say, oh, just strengthen your hamstring, stretch your hamstring, you'll be fine. But you really have to look at the big picture. You have to look at the core muscle groups and then also all the pelvic attachments that go into play. Yeah,
and there's been some research out there too that I've read about glute amnesia. Right,
Sure.
The glute's not firing, and now the hamstring having to work overtime or an overdrive to pick up the slack. I mean, what have you found in that area?
Yeah, so a lot of that has to do with the biomechanics, and I know you do a great job with Parisi Speed School with trying to teach athletes the proper form and going forward. We also do it at Atlantic Sports Health at our PT site downstairs, and the truth is it's something that's learned. It's a learned mechanical function, and if people are doing things, unfortunately, for a long time, it's hard to just kind of flip the switch and say, okay, now do it this way. Right. So that comes with training and practice, and obviously with getting your glutes to fire and putting yourself in a favorable position. What we've talked about in multiple things, right? The more favorable position the athlete's in, the less risk there is for injury.
Yeah, no, those are great points. Stretching the hip flexors, to get that pelvis in a more effective position to allow the hamstrings to go through the range of motion. The firing sequence, the glutes, and sometimes your glute might be firing, but it might just be late to the game. Right? I mean, having the glutes, a lot of people, they're butt muscles, they're not firing quick enough for that to take on more of the load. That's the prime mover at that hip extensor, and sometimes those hamstrings are used. But that's really great insight. What have you seen in your practice with hamstring injuries, and what would you recommend if someone pulled a hamstring? How would they come back to play?
Kind of progress back, yeah. So first, after an initial acute injury, what you want to do is take care of that injury. So the other stuff we're talking about, the mechanics and the risk factors and everything that happen, we're kind of past that point already, right? So we want them to rest, get as healthy as they can, and then really you have to seek medical attention for that physical therapy component to make sure that you're strong enough that your biomechanics are then taken, are looked at and evaluated prior to that return to play. And then ultimately there has been, like we talked about, the elite athletes, right, the soccer players, and they do an exercise it's called Kings, and I wish we could throw up a demo for you, maybe we could try, but the truth is what the athlete does is they're located on their knees, and it's called kings because you're bowing down, right? So you hold yourself up, and then you bow down, and all it takes is another person to hold down your heels while you're doing this motion, right? So you're eccentrically loading the hamstring on your way down, and then you contract and concentrically fire yourself back up. It's a simple exercise to do, but it's been shown that even if you do 2 sets of 10 twice a week, that it really decreases your risk of injury when you return.
Well, I think that's great advice. One, some strong eccentric work, you know, some very effective eccentric work, but also to make sure athletes, you know, see a therapist and they go to therapy. I think sometimes, oh, you got the hamstring, let it rest and you'll just get better.
With hamstring, it's complicated.
No,
it doesn't work.
Hamstring, ankle sprains, we talked about ankle sprains. You got to go see a therapist. You really should go see someone that can kind of get those muscles firing again. And, you know, there's little nuances that a therapist can provide and will provide to the athlete so they can recover and heal and get the firing sequence back in order. That's where a lot of people miss it. You know, not only to get muscles to fire, but to get them to fire in the right sequence. This was great insight, Adam. Really appreciate it. I know a lot of great information our parents and athletes are taking advantage of. Stay tuned. A lot more to come.